Dengue is one of the diseases that experts expect cases to rise during the rainy season. Now, as we celebrate Dengue Awareness Month this June, let's revisit ways on how we can keep dengue-carrying mosquitoes at bay and prevent ourselves and our loved ones from getting infected. Joining us now live via Zoom is infectious disease specialist Dr. Arthur Dessi Roman. Good morning and welcome to New Day, Dr. Roman.
Good morning, Doc Freddy. Good morning, everyone.
Now, during the first quarter of the year, we saw a rise in the number of dengue cases nationwide. Now, data from the health department show that over 27,500 cases were recorded from January 1 to March 18 of this year. That's almost double the cases compared to last year. Now, what do you think is the reason for that, Doc? What are some of the factors why cases continue to go up?
Well, there are a lot of factors to that. We can consider changes in the climate and a lot of increases in the amount of rainfall because you know that the breeding ground for all of these mosquitoes that transmit dengue is actually stagnant water. These are the places where they breed and they are able to replicate. And so with the increase in the number of mosquitoes, then consequently, there will be an increase in the number of dengue cases in the country.
Okay, now dengue is actually a cause for concern year-round. Pero ngayong rainy season, Doc Roman, inasaan ba natin na mas tataas ang bilang ng mga kaso?
Definitely, it used to be that the dengue was a seasonal disease usually in the rainy season, but based from experience and based from what we've seen from the data of the Department of Health, it's already a year-long occurrence. And on a personal basis, I also see patients with dengue consulting in months of the year that are considered not during the rainy season. So yes, you are correct, Doc Freddy, in saying that with the increase in the first 2 quarters of the year, we can still expect an increase in the number of dengue cases in the next 2 quarters.
Okay, and because of that, napaka-importante talaga ang prevention. So when we talk about dengue prevention, Doc Roman, syempre, nandyan yung 4S. Revisit nga natin, Doc, isa-isa itong 4S for our viewers and other simple and practical ways in order to prevent dengue.
Well, alam natin yung 4S, that's search and destroy the mosquito breeding grounds, as what I've said earlier, because this is where the mosquitoes thrive and that is where they start to grow. And you know that when there's a lot of mosquito colonies, then they can bring with them the dengue virus. So we need to make sure that there are no sources of stagnant water. We make sure that our environment is clean, and even the usual areas that we are not usually expecting dengue to breed. For example, the area dun sa ilalim ng drinking water, di ba? Nagkakaroon ng collection of fluid dun sa sinasalukan natin ng tubig, and also in the gutters kung saan nagdi-drain yung tubig. These are areas that we often nakakaligtaan natin na linisin. And of course, yung mga usual areas, yung mga sabi nga nila, classically, di ba, yung basurahan na nababasa ng tubig ulan, make sure that these are constantly cleaned. Next, in the 4S would be the self-protection of our Filipino population. Siyempre, we can use insect repellents that we should apply regularly to make sure that we are not getting bitten by all of these dengue-carrying mosquitoes. Whenever, Doc, whenever we feel that we have fever, whenever we feel that there's a muscle pain, all of those symptoms that are characteristic of dengue infection, it's very important that we seek early consultation, and that's the third S. This will ensure that we will be able to recognize early on the complications of dengue, and that we are properly advised on what to do and what to monitor in case we get the infection. And finally, the last S is about supporting the fogging and spraying strategies or campaign activities of the local government and our barangay units, because spraying of certain areas that are high risk for breeding for mosquito will actually prevent the transmission. So that's your
Okay.
4S, Doc Freddy.
Okay, thank you very much. And of course, be wary about the symptoms for dengue. And as we mentioned, the 4S, always seek early consultation kapag merong nararamdaman. Pag may fever, always seek help with your health professional. Thank you once again, Dr. Roman, for joining us this morning here on New Day.